And next presenter, Dr. Aditya Biswas on post-dengue retinopathy.
दूसरा लगा.
Yeah, I think it is there. It is there.
No, it is here only. But
वो तो नेक्स्ट वाला लगा रखा सीरियस ऑकुलर एडवर्स इवेंट्स विद इंट्राविट्रल ब्रोसिस मैम.
Good evening, everyone. I'm Dr. Aditya Biswas from RP Center, AIIMS, New Delhi, here presenting a case of post-dengue retinopathy. It was a 26-year-old female who presented to our center with no previous systemic illness and no apparent history of trauma. She had a history of dengue, NS1 positive 3 weeks prior, her chief complaint, and was treated for the same. There was chief complaint of bilateral painless progressive diminution of vision for the past 2 weeks. The systemic investigations which were done 3 weeks back showed a platelet count of 21,000, dengue NS1 positive and lymphocyte of 46%. All the other hematological investigations were within normal limit. Slit lamp findings showed best corrected visual acuity of 624 and right eye, and in the left eye it was 660. IOP, the adnexal structure and anterior segment was within normal limit. There were no cells and flares. The indirect ophthalmoscopy of both eyes showed multiple intraretinal subhyalate hemorrhages involving the fovea. The opto-CP image of the same patient shows in the right eye a subhyalate hemorrhage in the center, and in the left eye similar at the subhyalate hemorrhage at the macular, and there are superficial hemorrhages, intraretinal hemorrhages in the periphery. The OCT findings shows a subhyalate hemorrhage in this cross section and a superficial intraretinal hemorrhage in this cross section of the right eye. In the left eye there is a subhyalate hemorrhage which was seen. So our diagnosis was bilateral post-dengue retinopathy. Our plan was observation. On 3 weeks follow-up, we saw clearing of hemorrhages and the best corrected visual acuity was 618. On 6-week follow-up, the right eye best corrected was 612 and left eye best corrected visual acuity was 69. So on follow-up we see there's a right eye, there's an old hemorrhage present at the macula, and in left eye there is some macular pathology but it is not seen exactly on optos. In the right eye, as it was seen in the opto-CP, in the macular OCT similar findings are seen of an old hemorrhage. In the left eye, we see some kind of cystic space which has been formed in the macula. Probably it's an impending, it will impend to an lamellar macular hole. So dengue virus can manifest clinically in the eye as either ocular inflammation or as hemorrhagic complications. Ocular manifestations of dengue are subconjunctival hemorrhage, uveitis, serous RD, choroidal effusions, retinal hemorrhages and macular edema. Ophthalmic complications are usually seen in young adults who often present at the nadir of thrombocytopenia between 1 to 2 weeks after onset of symptoms. The take-off message is post-dengue thrombocytopenia can cause retinopathy, which can resolve spontaneously. OCT reveals persistent retinal changes. Patients should be kept in close follow-up to look for spontaneous resolution. In most cases, spontaneous resolution is noted. Intervention is not required. Thank you so much.
Thank you, Dr. Aditya. Actually, the other finding that is reported in dengue is foveolitis.
Yes, sir.
This is due to the coagulation abnormality that is coming, this pre-retinal hemorrhage.
Yes, sir. The 21,000 thrombocytopenia.
Yeah, that is real dengue retinopathy is probably due to inflammation.
Inflammation. There was the anterior segment was clear. There was no cells flare, and there was no RL cells in the posterior segment.
Look for both.
Yes, sir.
Go.
Thank you so much.